We will start tonight with that spike in overdose cases. What La Crosse County authorities are seeing in just the past 2 days, possibly linked to fentanyl. News 19's Roger Staffaroni spoke with those trying now to curb this troubling trend.
In the span of just 48 hours, La Crosse police found themselves responding to 5 overdose cases, all suspected to be fentanyl related.
As officers respond to these situations, preservation of life is paramount, and the amount that we're responding to is cause for concern.
While waiting on official toxicology reports, initial suspicions point to fentanyl being responsible for the surge. Prior to this, officers have responded to 4 suspected overdose deaths.
What tends to happen is we end up with a different or stronger batch of illicit substances that come into the community, whether they are mixing it with other drugs that normally don't have things like fentanyl in them.
Officers have been responding to overdose calls, knowing what they may be facing.
As with all situations with concern of suspected overdose or a rise in suspected overdose situations, officers are out. They are equipped with Narcan. All of our officers have Narcan.
If fentanyl is confirmed, it's important everyone understands the dangers involved.
If fentanyl is an incredibly potent opiate, it's just incredibly easy for someone to give someone much higher doses than what they are expecting.
The current cause for community awareness and concern has the Crosse Police Department partnering with Gundersen Health System's emergency medical staff, together educating and advocating to save lives.
The way that we're going to fix this problem is getting way upstream of it. That's ultimately the solution. In the meantime, we're focusing on harm reduction on those that are already caught in the despair of drug abuse, and keeping them alive long enough to get the help they need to get out and to recover their lives.
And you can find resources to get help for you or a loved one simply by calling the Great Rivers 211.